Everybody's concerned about taking care of their heart, and they should be. It's a big deal. You can do lots of testing to determine where you are. If you're a young person and you don't have a strong family history, chances are very high that you don't have heart disease. If you have a genetic problem, it's hard to find, but you could get worked up if you have any symptoms, chest pain, shortness of breath, hard to do things. If you're an older person, like me, 40s, 50s, I have a family history of heart disease, I'm going to be very cautious. I saw a great friend of mine, he's a cardiologist, and he did what's called a stress echocardiogram. Ran on a treadmill real hard, and they put a microphone on your heart, and they see how your heart pumps, and they make sure you don't have any funny rhythms or things don't look like your heart is starving for oxygen. Mine was great. There's one further test called a coronary artery calcium score. That's when they put you in a big donut CT scanner, and then they look for how much maybe tiny little specks of calcium are building up in your coronary arteries. Based on how much calcium there is, they can strongly predict whether or not you'll ever have a heart attack. It's probably the most sensitive and best diagnostic test that's available today. We're constantly learning new things. That's so 15 seconds ago, possibly, I don't know, but it's something that you keep in mind. So everybody who gets these tests is offered cholesterol-lowering drugs. Well, there's a level that everybody wants in cardiology, and that's as low as possible. I don't really necessarily think that's a good idea. I think getting the cholesterol down to a reasonable level so that the total cholesterol is under 200 is important. You can use drugs like Lipitor and others. They're called statin drugs, and they tend to have a reported side effect profile of about 2 to 3%. In reality, based on the most recent discussions I've had with cardiologists, it's really 20 to 30%. Red yeast rice at 500 to 1,000 milligrams a day has a little bit of statin in it and 1,000 times less side effects. So if you want to treat your cholesterol issues with your doctor's permission, try red yeast rice.